We're on. Okay, well, hello everybody. Welcome to the Healthy Joints Healthy Lifestyle Show. So, for those who don't know me, my name is Dr. Aminola Dada, and I help people with joint pain become pain-free, and people with autoimmune disease get their immune system back on track. So, today we have an amazing guest. Her name is Dr. Carola Okogbaa. Dr. Carola is my very good friend. Okay, so we're gonna have fun on this talk. Okay, Dr. Carola is going to tell us all about dry eyes. So I'm going to let her introduce herself, but I'm going to start off with that. She is a premier ophthalmologist in the Baton Rouge area. And that's what I'm going to tell you. And so if you have any ocular issues, Dr. Carola Okogbaa is the go-to person in Baton Rouge. So we are just lucky to have this expert on our show today. And I'm going to let Dr. Carola Okogbaa tell us why she does what she does and what makes her passionate about her work. Thank you for coming
Wow.
in.
Thank you so much. That was such a wonderful introduction. I really appreciate you having me on, and it's really an honor. So my name is Carola Okogbaa, as Dr. Douglas said. I am an eye specialist, an ophthalmologist, an eye surgeon. I'm the CEO and founder of Louisiana Center for Eyes. And what we do there is we help individuals meet their best vision so that they can really just experience life better because they can see better. So that's all
Imagine
she
that.
does, is helping folks see better one at a time.
And she does it phenomenally. I'll tell you that much.
Thank you so
So,
much.
Dr. Carola, so today we wanted to talk about the topic of dry eyes, right?
Mm.
And and so can you tell us a little bit about dry eye disease and what causes it?
Yeah, I'm really glad we're talking about this topic because dry eyes have become a condition that has really exploded in the last few years in the eye world, right? It used to always be something, but now it's a lot. Everyone is experiencing some degree of dry eyes, from kids to adults. So, as a comprehensive ophthalmologist, I see that a lot, and prior to us doing surgeries, we have to also address dry eye. So it's become a big deal. So what dry eye is basically, the eye is exposed to the environment. So it has its own natural system that's in place to keep it moist. Okay, so our eye is the only kind of like mucous membrane that's exposed to the elements. So it has its own internal system that keeps it moist, and it produces this constant tear. We call it a tear film, and it has three different layers, and we want each layer to work. When we don't produce enough tears, or the quality of the tears that we produce is not good, then we call it dry eyes. So that means the eye is not functioning at its proper and optimal degree. Okay. So then, what are some of the causes? One, age, of course, medications, certain medical conditions, like, of course, rheumatoid arthritis, lupus, autoimmune conditions, inflammatory conditions, common conditions like diabetes, believe it or not, can contribute to dry eyes. Okay. Certain medications we take, antihistamines, blood pressure medications. And of course, one of the biggest things these days is how much we're using our eyes on our digital devices, computer. That's the biggest thing that we are seeing that's exacerbating and causing dry eyes for folks.
Oh. So it sounds like it's the quantity and quality, right,
Exactly.
of the tears that we're producing. You mentioned mucous membranes. Can you tell us a little bit more what, because you and I know what that means, but
Yeah, so it's just basically mucous membrane is just the part of it's just the tissue that has a fluid component to it. So really the way I think about it is that it needs to remain moist, right? So when you think of
Yeah.
mucus, you think of um uh something almost slimy, I guess you could think about
Yes.
it.
Yeah. Yeah. That's a good one. Yeah.
Yes, but when it dries out, it doesn't work and function well. Just like our mouth, right? Our
Yeah.
mouth,
Hmm.
inside of our mouth is all mucousy and wet. We want the eyes
Yeah.
to remain like that. But with our
Yeah.
mouth, we can close it, right? With our eyes, it stays open. So it has its own system to keep it moist even when we're using our eyes and it's open and we're in the elements. And so
Yeah.
that's what I mean by mucous membrane.
Because remember, that's so helpful, actually. I actually really like that slimy. And
Mm,
that just gives you a good visual.
right.
Okay. So what are the symptoms? How do people feel it?
Oh,
How can
wow.
you
Yeah.
tell?
Yeah. One thing I love about the eyes is that, it works, it works, it works until it doesn't, right? And that's when
Yeah.
folks start freaking out. What's going on? All of a sudden, my eyes are red, right? They feel gritty, like there's something in them. Rubbing the eyes is actually nothing. It starts to tear up, as a matter of fact, start having a lot of tearing. Some people get all that burning sensation. Another thing that happens is the vision starts to fluctuate. They can't stay long reading a book.
Mm.
They can't stay long in the computer. The eyes start
Huh.
getting fatigued and it's just uncomfortable. So now instead of focusing on the work you're doing in the computer, you're thinking about your eyes like, oh my gosh, I really can't see this. So you're doing all kinds of
Yeah.
gymnastics with your eyes.
Yeah.
That's when that dry eye starts to have an impact on you.
Yeah. Yeah. I used to tell my patients that it's kind of like someone put sandpaper and replaced your eyelids with that. And yeah, you can little drama there. But I
Yeah.
think everybody's like, I know what that feeling is, right? So
Uh-huh.
when they have dry eyes.
Yep.
So what are there things that we can do? I mean, I think you alluded to that, all this time on our devices is
Mm-hmm.
worsening our symptoms. But are there other things that can worsen these symptoms?
Yes. I would like to say lack of sleep is probably one of the biggest things, right? Because when we don't sleep, the eye doesn't have a chance to rest and rejuvenate and renew itself. So it's like it just keeps going on 10. And when it keeps going on 10, it just start to not function well, and folks start getting that eye strain, that headache. That's when the grittiness start to become more of an issue. The other thing is being dehydrated, not drinking enough fluid,
Yeah.
right? The eye also needs, it's an organ, so it needs the proper, yes, I see you got your water. It needs proper hydration, just like every other organ in the body. And
Yeah.
so, yes, of course, whenever you take medications, you have to be aware that certain medications, like your fluid pills or things that drain you out, like some of these blood pressure medications, they can contribute
Yes,
to
that's true.
the eye being dry.
Yeah.
And there's
Yeah.
certain conditions that's just naturally, like Sjogren's, right? In your world,
Yeah.
it just naturally causes the mouth to be dry and the
And
eyes
the eyes. Yeah.
are dry as well.
Yeah.
And so yeah, so we see a lot of that. The other thing I would say that can exacerbate dry eyes is having sleeping in a fan with a fan on. Believe it or not, it actually dries their eyes out.
Wow.
Uh-huh.
Okay.
Folks who
Okay.
wear contact lenses, over time, the eyes can get
Yeah.
dry, especially if you're
Yeah.
not really taking care of your eyes when you
Guys,
use
yeah.
contact lenses.
Wow. Yeah.
And
Yeah.
then not taking breaks from the digital devices. So we actually have a rule, right? So the American Academy of Ophthalmology, we have this came up with, I believe it was the Academy that came up with this rule called the 20-20-20 rule. So for every 20 minutes you're on the computer or you're doing focus work, you should stop, right? And look far away. You want to look at a far away object because they say think about something that's 20 feet away, and it's breaking that stare, that constant stare that we're doing in the computer.
Mm.
And then the next 20-20 means for 20 seconds you kind of blink your eyes because you want them to work. Every time we blink, that's when we use tear film. We're rejuvenating our tear film.
Yeah.
So when we're not blinking so much and we're
Yeah.
staring at the screen, we're not producing enough tears to keep the eyes functioning for the amount of time that we're forcing it to work. So over time, it causes your eyes not to make enough tears, and then the quality of the tears go down. And if that keeps going, that's when the dry eyes gets worse and worse and worse.
Mm. This is serious. So 20, 20, 20.
20,
So
20, 20.
okay. Okay. So you look at the computer, you look at a distance 20 feet away, and then blink your eyes, which I've
That's
already
right.
started immediately. Yeah. Okay.
Yes,
Okay.
yes.
Okay. So what happens? So I the final now, it's like people are like, okay, fine. So I have dry eyes. What happens if I don't take care of it, if we don't do something?
Oh, well, if you don't, your eyes will it will force you to, right?
Mm.
Because over time it gets extremely uncomfortable,
Mm-hmm.
and it becomes a big distraction to you. You know, whenever
Yeah.
something's in your eye and
Yeah,
you can't do anything, you're like, man,
you can't sleep.
you can't
You
sleep,
can't sleep. You can't. Yeah.
and it will force you to
So
do something
you will
about
have
it.
to take action.
You have to take action, otherwise it gets worse, and it starts
Yes.
to impact your actual vision,
Vision. Yeah.
right?
Yeah.
So it causes what we call fluctuation in vision,
Vision.
where
Yeah.
some days you're seeing clear, other days, no matter what
Days.
you do, you can't get a good
Good
focus.
vision. Yeah.
Driving at
So
driving becomes difficult because things
yeah.
are getting fuzzy, and it
Yeah.
becomes a real an issue that you find yourself having to address. So yeah,
Yeah.
it will force you to do something
Yeah.
about it. Otherwise, it gets worse.
Yeah,
Mhm.
interesting.
Yeah.
When I was just kind of reflecting on what you said, is that, one of the symptoms of dry eyes is tearing. And you
Mhm.
know what people would be doing though? Some people may say, you know what, it's my allergies. And then they start taking antihistamines.
Mhm, mhm. Yeah, it's interesting because where I live, allergies, almost every person have allergies in Louisiana. So you can have both dry eyes and allergy eyes all at the same time. So the inflammation that comes from the allergies exacerbate your dry eyes. But then you have the tearing. So if you have just baseline dry eyes, so your eyes are dry, but it's tearing. The reason why it's tearing is because the eyes are constantly sending a signal to your brain, telling your brain, look, I'm dry,
I'm
I'm dry,
dry.
I'm dry, I'm dry. So all these nerve endings we have is sending the information, I'm dry. So now the brain sends information back to your eyes, say, well, make more tears,
Yeah.
make more
Wow.
tears. And so
Make
it's
one.
kind of like a reflex tearing, but it's not your true tears that you want, because that becomes
Yes.
a problem if it's tearing too
Yeah.
much. So it's because
Yeah.
it's dry at the core. That's
Hmm.
why it's tearing up like that.
Okay.
Yeah.
Okay. Okay. So when should we see a doctor?
Well, really, everyone should get an annual eye exam just to get a checkup, right?
Yeah.
But if you're starting to have these symptoms that we talked about, the
Yeah.
eyes are feeling gritty, or you start noticing this constant blurriness that comes and go, you
Yeah.
start feeling the burning, the itching, the irritation, just see your eye doctor.
Yeah.
Also, the good thing is now, like if you go to a drugstore, there's like a whole aisle on dry eyes, right? Just
Mm.
teardrops, allergy drops, all kind of drops. Because one of the initial treatments that we tend to do is to just replenish the tears that you're
Mm.
not making well,
Artificial tears.
artificial tears. Start
Mm.
using some. And
Mm.
then for me, the biggest thing I find is resting the eyes.
Mm.
Sleep.
Okay.
Actually
Imagine
sleep.
that.
Get off the digital devices for a little bit.
Mm.
That's,
Yeah.
I have folks, oh, they're like, Doc, I'm not gonna lie to you. I'm on that game, I'm spending a lot of time on the games on the phone. And that's adults, not even the young people.
But
Yeah,
they are, yeah, well, those games on a parallel topic, those games, they have something in them that stimulate your dopamine, and so you want to play more.
yes, and I tell them that. And I tell them that. And because of that, I'm seeing a lot of teenagers and younger kids are coming in
With
with dry
dries.
eyes. And
Yeah.
we're not blinking. When you don't blink,
Mm.
we can go into the meibomian glands. We start losing them, and they don't function as well as they should because we're
Yeah.
not helping them to function. So there's a
Yeah.
lot of things that
Yeah.
goes to the eye.
Yeah. So you
I'm sorry, Doc. I think I missed you there. I'm not hearing you at all. Can you hear me? I can't hear you. Can you
Stinkies.
hear me, Doc?
I can hear you. Can you hear
Okay.
me?
Yeah, now I can hear you, but I missed
Okay.
what you
Okay,
said.
that's fine. Okay, we're back. Okay, so I think what I was saying was that what else can we do? We talked about artificial tears, we talked about resting, less time in front of the digital devices. What else can we do to manage dry eyes when a person has it?
Yeah, the biggest thing is really see your eye care
Okay.
physicians, just see your doctor because then they
Yeah.
can come up with an individualized plan for you because
Yes.
now they see what degree of dry eyes. Maybe it's just mild, you just need to use
Yeah.
some teardrops.
Yeah.
Other times we need to put you on prescribed medications
Yeah.
to
Yeah.
really help the eyes. And then in severe cases, there's other dry eye treatments we do in the office
Yeah.
that really helps the eyes. So there's so many different things you could do, but at home, all of these environmental things, staying hydrated, getting rest, not sleeping with a fan on,
Yeah.
using warm compresses on your
I
eyes.
was
Those
gonna
are
ask
some of
about
the
compresses. Yeah.
yes. So those are some
Okay.
of the home remedies
Yeah, just that
that
you
you
can
can
do.
do just to
Yeah.
maintain your eyes, just to keep them healthy because we do use them a lot.
Yeah. So when you mentioned that, just trying to get a visual, when you mentioned the fact that it's, when you don't have enough fluid in the eye, you don't have enough of a lubricant, and then your eyelid is almost like sandpaper. What does that do to your cornea, by the way, that outer
Ooh.
lining of your eye?
Yeah, glad you asked. So because now the eye is more exposed, right? The film that should be there is not there anymore. So that's why it causes the vision. So when we're looking at something, it gives a blur vision. The cornea receive a blurred vision, and then it takes that blurred vision to your retina. Okay. The other thing that it does, it causes the cornea to be more susceptible to scratches, corneal abrasions, right? And
Yeah.
it can cause it to even to get infections like
Yeah.
corneal
Yeah.
ulcers,
Yeah.
just because of the chronic
Yeah.
dry eyes. So yeah, so that's really some of the main things
Things.
it can
Okay.
cause. And then once you have an infection, that can cause even bigger problems for you. It can lead to vision loss.
So I know you have a lot of because we've kind of talked about patients in the past, and I know that you have a lot of patients that have had really good outcomes. But I want you to tell or share a story, if you could, with our audience of a patient that you've had who had an amazing result after kind of seeing you. I know there are plenty, but share
Oh
one.
yeah. I definitely remember. I had a patient a few years ago who came to me, and she was just having these same type of symptoms we were talking about. She couldn't spend more than 5-10 minutes doing her work on the computer, and her eyes were feeling gritty and scratchy, that sandpaper like feeling, and it was just very uncomfortable. And she thought she was going blind. She
Wow.
thought, I don't know what's going on with my eyes. They're not functioning well. I can't drive well. I can't stay on the computer. Nothing I'm doing is I can't see. I feel like my vision is going. And so after we did a complete eye exam on her, everything else looked nice and healthy. I told her, look, the only thing I'm seeing really is your eyes are dry. They're
Wow.
just dry. And so we kind of start this journey of working on her dry eyes. I gave her some recommendations of what to do at home. I put her on some medications, and then kind of just start following her every few months to make sure she was doing better. Well, one day she came in and she said, Doc, you saved my business. And I was like, what do you mean? I'm thinking, hey, I just helped you with your dry eyes. You're good. She's like, yeah, you saved my business because I am an editor. So
Oh,
her eyes
it's
are
her
her
business.
profession. And she was like, she edits papers, articles, and things like that. And she couldn't get through one without, it was taking her 2-3 times that she needed to do
Longer.
one item. And because of that, it was impacting how many she could do and how many clients. And I had no idea how much just treating
Was
this patient's
impacting.
dry eyes
Yeah.
eventually helped her to get her business back on track. Because now her eyes were good. She knew what to do. she was able to stay on the computer for whatever length she needed to and actually get her work completed and felt confident in her work because she can see
Yeah.
what she's doing
Yeah. Yeah.
and editing. So I thought that was amazing because I didn't think I was helping her to that degree, but she's like, yeah, you saved my business. I'm like, oh, okay. I'm glad we saved your business.
Wow.
Yeah, just
Well,
from
that is, yeah.
dry. Mhm.
Sorry, I interrupted. Go ahead.
No, yeah, I was saying, yeah, this is just from treating her dry eyes.
Wow, that's so impactful though, because and thank you for sharing. So I mean, because the issue is that we as human beings are so adaptable, right? So like you were saying, so she was just kind of managing, and so she's trying to read her, do her work, and then she's finding that it's taking her longer, and she doesn't trust the work, so she's taking her longer because she's reviewing her reviewed work, and so she's just kind of pushing that out and realizing, hey, what used to take me, a couple of hours now taking me a full day. And so thank you
Right.
so much for making that impact on her life. And I think it really brings back to what you said about
Yeah.
the fact that, when you're having such severe symptoms, you really should see an ophthalmologist. You
Yes.
really should see the specialist, right? Because then you were able to individualize the treatment for her that got her to where she needed to be. And she didn't really realize, she wasn't coming to you saying, hey, save my business.
That's
She probably may not even have realized, right, that
right.
that was the thing. I'm just going slower. You know how we are as human beings. We're just going to be adapt,
Hmm.
right?
Hmm.
So, wow, that is really an impactful story. Not only did you save her vision, but you actually maintain her quality of life because now she can continue to her work, right?
That's
That she
right.
loves so much. Well,
Yeah.
thank you.
Yeah.
That is actually
Yeah.
moving on multiple levels.
Yes.
So, thank you for sharing. So, I think question for you before I let you go. Thank you so much for your time. But the other thing that I think is really coming to the forefront, especially in the dry eyes world, in my world of Sjogren's, is clinical trials. Do you have any thoughts about, why people should participate in clinical trials?
As a physician, I've come to believe that clinical trials are extremely important. So just in the eye world, studies and like we have all of these new treatments that are helping people in such a stronger level, in such a powerful way. And the reason why we get these treatments that we can help more people, that we can get healthier eyes and save lives, is really because folks participated in these trials so that we can get good results that can be effective in treating whatever condition they have. So I believe everyone, if you have an opportunity to participate in a clinical trial, you should. The other thing is, especially, you want these medications and treatments and things like that. You want them to work for you and people in your own demographics, right? And so the way you know it's going to work for you is you participating.
Yes.
And the way it will work for people in your demographics is that, like, I'm a person of color. I'm female. I want more people of color and more females to participate in these trials, right? Because the results will then work for folks like me. And that's why I really emphasize participating in clinical trials.
That is right to the point, Dr. Carola. That is right to the point. Is like if we don't have people, we're so many diverse ethnicities,
Mhm.
and we're also a potpourri too. So if we don't have people of diverse ethnicities and backgrounds participating in the trials, then we're going to find out that perhaps the medications or treatment plan for one set of people does not necessarily go across the board, and then
Right.
we are left out of the trials and left out of the results, and so no one really knows how best to treat you, right?
Exactly.
So I think it's really a responsibility for each of us, to really, if there is an opportunity to participate in the clinical trials, and you really get more attention that way, and I think it actually helps you to be more empowered towards your health.
Mhm.
But
Yeah,
yeah, Dr.
absolutely.
Carola, thank you so very much for coming on the show. And with that story of the impact, I know there are a number of people out there that want to contact you, find you, work with you, help you cure their dry eyes so that they can get their lives back and so that they can get their jobs and careers back. So how can
That's
people
right.
find you?
Yeah, so I am on just about all the platforms on social media, Louisiana Center for Eyes on YouTube, www.LA Center for Eyes is our website. And you can always reach out to me there. We're also on Facebook and Instagram at Louisiana Center for Eyes. So yeah, reach out. And if you're in the Baton Rouge, Louisiana, South Louisiana, Baton Rouge area, give us a call, come on by. We'd be happy to see you.
Fantastic. Well, thank you everybody for listening. If you think this video has been helpful, like it, share it, subscribe to our channel, subscribe to our newsletter at Overlake Arthritis and Osteoporosis Center. Thank you so much for listening. And Dr. Carola, thank you so very much. I know today's a busy day for you, but thank you so much for spending the time. Enjoyed this. Share it. And everybody, I'm going to be sharing with the patients in my office. I think this is so helpful for anybody with dry eyes. It is a must listen to. Thank you so much, Dr. Carola.
Thank you so much for having me. I really enjoyed our conversation. I think a lot of people are going to get something from it.